raise your hand if you understand that physical therapy as a profession is in an absolute disaster situation. Raise your hand if you believe that physical therapy as a profession is not as good as you think it should be. Raise your hand if it's not what you thought it was going to be. Raise your hand if your career is not going the direction that you had thought it would go. You're not making the money that you thought you would make. You're not getting the results that you thought you would get. It's just a bunch of smoke and mirrors getting you through school and then dumping you into the broken medical model. And now you feel like you're confused, like you're frustrated, like you're lost, like you're getting burnt out extremely quickly. So raise your hand if that is you, okay? I'm inferring that the overwhelming majority of the people that are watching this, whether you're a new grad, you're experienced PT, maybe you're a chiropractor, maybe you're a athletic trainer, maybe you're a strength and conditioning coach, and you're watching this, and you feel that your professions are also not where they should be. So I want to talk to you today about somebody who's in my profession that I've actually worked with as a business coach, who's come up with some ideas to fix all of the problems that we're having with physical therapy. Now, as I break this down, and I believe if you asked him, most of what he is addressing here is outpatient orthopedic physical therapy, not inpatient rehab type settings. So what I'm gonna do is give you he's got a 3-bullet plan to fix physical therapy, to increase reimbursement for physical therapists, to give you better job satisfaction, to get you maybe, actually, now that I think about it, he doesn't even talk about it, outcomes. So outcomes must not be a problem. So I'm gonna go through his 3-bullet remedy for this problem. And then I'm gonna break down each one of those bullets and explain why I believe those will do absolutely nothing to fix the profession. And at the end of this, I'm gonna tell you the reason why we differ on this is because we believe the root cause of the problem with our profession is 2 completely different things. And this guy is blaming this over here, and I'm going to blame this over here, which are 2 completely different things, which is why our strategy to fix the problem is 2 completely different strategies. All right, so let's get going. Let's talk about his strategy. So his name is Frank. He does coaching for physical therapists that are trying to create side hustles so they can actually have income and start paying off their student debt rather than sitting at a mill, not making any money, getting frustrated, and just living with debt. So that's where he's coming from. And his big frustration is with the medical model is that he had a family member that passed away that he attributes to poor medical attention. So he's extremely frustrated with the medical model, as am I, as are you, I'm inferring. But we see it as 2 different problems that are causing this situation, okay? So Frank has come up with 3 bullets, and here they are to solve the physical therapist problem, the physical therapy profession problem, and this is mostly outpatient ortho. So according to Frank, what you should do, number 1, is if you work for a mill or if you work for a hospital-based or physician-based clinic, you should get your coworkers together and go to the boss and complain about the situation. So complain about your pay, complain about your hours, complain about maybe your autonomy. He doesn't ever say anything about outcomes. So don't worry about outcomes. Don't worry about that your patients aren't getting any better. Just worry about that you're not getting paid. So I'm not sure how that solves any problems, because what your employer is going to say, what they've been saying for decades is, I can find more of you, because PT schools are going to churn out more new grads every year. And if you don't like it here, you think you're worth more, go somewhere else. I'll replace you. No problem. Piece of cake. I'll just keep feeding the system. Now, Frank may come back and say, well, then those people need to get frustrated and they need to go and talk to the boss and say, we should do a better job of this. Guess what? The boss, especially when the boss is big medicine and the boss is big physician groups doesn't give two shits about you as a physical therapist or a PTA or an ATC or whatever, because they're going to run you in the ground and replace you, and your replacement might even take less pay. So according to Frank, get everybody together, have a little powwow, and then go to the boss and say, we're all mad. I would say, don't waste your time. That's not going to happen. If you just want to get fired or quit, just go get fired or quit. Don't waste your time trying to do that, because you're not going to get anywhere with that. Number 2 bullet would be to join the APTA. So now, in Frank's defense here, he has stated that he is not a fan of the APTA, but what he is saying is that if you're not a member of the APTA, then the APTA doesn't hear your voice, so you need to join the APTA in order to make your voice heard and let them know that you're not happy about what's going on. Guess what? The APTA already knows that you're not happy, and they don't care. So once again, the APTA is a big conglomeration. Their bills are getting paid. They're making money. They already know that you're not happy. They don't care about that. Go to CSM and take a look at what's going on there. Tell me that that looks like what you want our profession to be doing. Selling gimmicks, selling garbage, putting people on garbage machines to control or calm down their symptoms. That's all that is, okay? And all the APTA's messaging is, we've been doing this forever and we're gonna make it better. No. What happened to the APTA's Vision 2020? Absolute garbage. They pushed that forever. Was a terrible idea. And we're in the same position in 2024 that we were when I was in PT school in 1998. Okay, so the APTA is not going to change whether you're a member or you're not a member. They're going to listen to the people that they like to listen to that say, oh, the APTA is fantastic. They do so much for us, even though they don't do jack shit. The APTA is not going to care. So joining the APTA and getting this groundswell going is not going to change anything. He also goes into that we need to make sure that the APTA has one single message that we're sending out to all of the consumers out there. Okay, that's great. But the APTA's message is going to be, we love physical therapy. Do physical therapy because it makes you feel better. People have heard that message. People have figured out that physical therapy doesn't work. Why do you think the majority of people don't finish their physical therapy plan? Why do you think, I think it's like 40 or 50% of patients don't even show up for their second visit because they figured out on their first visit that their physical therapist is clueless and they're not going to get any better, so why waste their time? Okay, so the APTA's message is going to be a broken message that people have already heard. So getting the APTA to put a new marketing campaign together when there's actually nothing of substance behind it is not going to solve any problems. Okay. So Frank also says that the APTA should be marketing to consumers. So remember, the APTA, the head of the APTA and the board of the APTA or the higher ups of the APTA are making the money they want to make. That's all they care about. It's the same as any other business. The APTA is not sitting there going, boy, I'm really worried that we have all of these new grads that are going to go out there and get confused and get burned out within the next 2 years. They're not saying that. They're saying, oh, I still got my Mercedes outside? Cool, I'm good. Keep going. We'll get more people to get through PT school and we'll push them into the broken system. They'll burn out, but no problem. We'll be replacing them without any problems. Okay, so joining the APTA, getting your friends together to join the APTA and try to get the APTA to come together and have a marketing scheme that goes to consumers to tell consumers to go to physical therapy is not going to solve any problems. All right. Now, his third bullet point is educate the public. Okay. What are we going to educate the public about? Because here's what the majority of the message is from the broken medical model and the broken physical therapy model. If you have pain, stick needles in it. If you have pain, put cups on it. If you have pain, put tape on it. If you have pain, roll it. If you have pain, Theragun it. If you have pain, massage it. So there's the message. That's the message that most people get. So when people come into my clinic and ask, why don't you have cups and needles and all that kind of stuff, then I actually go and educate them as to why we don't do any of that crap, because that stuff doesn't do anything to fix the root cause of your problem or even address or even figure out what the root cause is. So why would we be doing that? So how are we going to educate the public when our messaging is all over the place? So I hear this all the time. Physical therapists need to have autonomy and they need to be able to do whatever they want to do, whenever they want to do it, for whatever reason what they want to do, because that's autonomy, and you're a doctor of physical therapy that should be able to do whatever you want to do. I'm wondering where it comes into that we say doctors should be using science to treat root cause and get to the patient's problem in order to resolve the root cause of their problem and normalize function by using critical thinking and scientific standards that we've had for centuries. Instead, what we say is find something that people think feels good, and do whatever they think feels good and do more of that until they feel better, even though they're not getting any better. It doesn't matter. Just trick them and do that and charge them a copay and then charge them cash pay for an hour visit when it's absolutely ridiculous to spend an hour with a patient doing garbage treatment. Okay. So this gets us to where, Frank's 3-point bullets are: number one, gather all your coworkers together and go tell your boss you don't like the way things are working and think that your boss is going to renegotiate contracts with insurance companies because insurance companies are the problem. No. Number two, join the APTA because you can change what the APTA is doing by getting this groundswell, and then the APTA is going to market directly to consumers, and consumers already figured out they don't care about physical therapy anyway. And number three, educate the public and make sure they understand that we have things like direct access to physical therapy that doesn't work, that they don't return to their treatments for. Why would we do that? I don't know. Okay, so here's where Frank and I, and basically myself and everybody else, differs. So people that go cash and people that want to do all this stuff and think that they can fix physical therapy, their focus is on that the problem is insurance. Insurance is not the problem. Their focus is the problem is that patients don't know what we do. That's not the problem. Their focus is that physical therapists don't make enough money. That's not the problem. Okay. The problem is, and what we didn't hear in Frank's breakdown here, is patients get shitty outcomes. Why would you pay any money to go see somebody 2 to 3 times a week for 6 to 8 weeks to have the same problem at the end of 8 weeks that you had at the beginning of 8 weeks? And by the way, you're paying a $40 copay. Or now we have these cash pay PTs that are out there charging $250 for an hour visit to do the exact same garbage that the in-network providers are doing with symptom modification gimmicks. So let me get this right. So charging you $250 to spend an hour with me to do the same garbage to get the same limited to 0 results is a better product for the patient. No, it's not a better product for the patient. It's a better product for the egomaniac who thinks that because they're a doctor, they're worth $250 an hour, even though they're not worth any dollars per hour because they don't get any results. Okay? So Frank and everybody else want to blame insurance and blame big medicine and blame all this stuff over here. Here's who I want to blame. I want to blame PT schools, because PT schools don't educate you as to how to become a clinician. They educate you on how to pass a test. So the important things that you should be learning in PT school: anatomy, biomechanics, neuromuscular physiology, critical thinking, to put all of those things together in order to get to root cause, assess and address root cause, reverse what is happening there to get functional returns in 1 to 2 visits that last because you biased using critical thinking to use science to your advantage. That's what we should be attacking. Why are PT schools wasting 3 years of your life, 6 figures of your income, killing your career, and telling you, now that we've taught you how to pass a test, we're going to dump you in the broken medical model and it's up to you to figure out how to be a clinician? You need to go find a mentor. Oh, wait a second. All of those mentors that you're supposed to be finding, they're also a product of the broken educational system, and they don't know jack squat about what they're doing either. So when you ask them for their advice, they're going to give you the same crappy advice that their mentor gave them. So you're basically getting advice from a mentor who got it from a mentor who got it from a mentor, and you're learning 1970s PT. Passing that off to your patients, not getting any outcomes, which is why your patients don't come back. Not because they're non-compliant, not because they're malingerers, not because they just don't want to get better. It's because you or the clinician doesn't know what they're doing. You're not giving them results, so why would they come back? So I blame 100% of the blame, in my opinion, goes on PT schools. It should not take you 3 years to learn how to be a clinician. It should take you 1 year to take what you already learned in undergrad. So let me get this straight. You're going to take anatomy, biomechanics, physiology in high school. Then you're going to take anatomy, biomechanics, physiology, chemistry in undergrad. Then you're going to take all those courses again for the first year of PT school. Then you're going to learn how to do a little bit of clinical stuff, but not enough to actually make sense, because that's not on boards. We need to teach you how to pass boards. Then you're going to go out on clinicals. You're going to hang out with somebody for 6 weeks to 2 months to learn how they manipulate symptoms, because they never learned how to be a clinician either. Then when you're going to graduate, and then it's going to be up to you to take CEU courses, which aren't going to teach you how to be a clinician. Find a mentor who can't teach you how to do that. Or get more experience. Being frustrated and lost and getting more experience will fix your problems. No. So here's what we need to do. We need to say PT school is irrelevant, unimportant, and should be avoided. That's right. So if you want to be an outpatient PT, you don't need to go to PT school. Understand that personal trainers, athletic trainers, PTAs, all of those people can do what you do as a doctor of physical therapy, with the exception of 2 things. So people that want to go cash should just go cash. You can do everything a physical therapist does except call yourself a doctor of physical therapy and bill insurance. So if your goal is to open up a cash pay clinic and work with a niche of dancers or cowboys or whatever it is, you can do that without going to PT school. You learned anatomy, biomechanics, physiology in undergrad. Now you need to know how to apply that, and PT school is not going to teach you how to apply that. PT school is going to take your money to teach you how to pass boards after 3 years of frustration and driving you into the ground, okay? So if we want to fix the problem, which is our profession failing and clinicians dropping out and clinicians not getting paid what they're worth. So do I think that physical therapists are worth 6 figures? Do I think that they're worth $250 an hour? Yes, I do. As long as they earn it, as long as their outcomes dictate, yes, they are worth that. I don't think they're worth it because they got a piece of paper that says they're a doctor. That means jack squat, because there are a lot of physical therapists that suck, okay? So your worth is determined on your outcomes, and your outcomes should drive your business, and your satisfaction should be driven by your outcomes. So see how this all goes to outcomes, and physical therapy school is not going to give you outcomes? So unless we completely revamp PT school to make it what it should be, not a money-making cash cow for universities, but something that takes a year, because that's all it takes to review and then apply science. Once we do that, then we can have less frustration. Then we can get away from insurance. Insurance can go do whatever they want. We can go over here and do our own thing, and we don't have to be participating with insurance. And people will actually pay for it. So let me know what you think about that. Do you think that insurance is our problem, or do you think the educational system is our problem? Let me know.